Did you know that as of 2013, Georgia averaged 3 infant deaths per week due to sleep-related causes? These are deaths which are preventable. It is so important that all parents, caregivers, and family members know how to put our babies to sleep safely and correctly. So what exactly is safe sleep for babies? The American Academy of Pediatrics recommends the following ways to keep your baby safe while sleeping. There is a simple formula we can share with anyone that may be putting our babies to sleep. It's as easy as A, B, C. A, alone. Always put a baby to sleep alone in their own safe sleep space. B, on their back, every sleep, every time, including naps. And C, in a crib with a firm mattress, tight-fitted bottom sheet, and with nothing present that could pose a risk of suffocation or strangulation, such as blankets, bumpers, toys, and pillows. First, make sure that your baby has his own safe sleep space. The safest place for your baby is to sleep alone, not necessarily in a separate room, but alone in their own bed. Room sharing is okay. Bed sharing is not. Room sharing means keeping your baby's sleep area close to, but separate from where you and others sleep. If you wish to room share, place a bassinet, crib, or pack-and-play near your bed, within arm's reach, where your baby is alone, but not in bed with you. This will make it easy for you to bond and breastfeed your baby during those early months, but makes it convenient to put your baby back into their own safe sleep space, separate from any risks of suffocation or entrapment. No matter what kind of sleeper you are, it is never safe to share your bed with a baby. Let's take a look at what an unsafe and potentially dangerous and deadly sleep environment looks like. When looking at this sleep environment based on the ABCs, alone, back, and crib, what would be the risks for suffocation and entrapment in this picture? All sleep environments should be bare with nothing but the baby. This crib is full of suffocation and strangulation risks, blankets, crib bumpers, and toys. Babies can fall asleep very easily on a parent's chest or lap. It is especially dangerous if the person holding the baby falls asleep with the child. A child could easily slip off of their chest or lap, getting entrapped between them and the couch, chair, headboard, or footboard. When caregivers bed share, they risk rolling over onto their baby, or the baby getting tangled in sheets and blankets and suffocating. There is also risk in the baby falling to the floor or getting trapped between mattress and headboard or footboard. A baby should always be placed on their back and make sure that the crib is clear of all items. You can never ensure that a baby won't become wedged against blankets, toys, bumpers, and pillows. Babies, especially infants, cannot lift items from their face and often don't notice when their oxygen intake is restricted, leading to suffocation. Let's take a quick look at some appropriate safe sleep spaces for baby. Cribs, bassinets, or pack-and-plays are appropriate places to put babies down for nighttime sleep or daytime naps. Examples of unsafe places for baby to sleep are sofas, chairs, air mattresses, and car seats. These should be off limits for both daytime and nighttime sleep for baby. These surfaces are not considered firm. Pillows and cushions can suffocate, and a baby can easily get entrapped between cushions and the backs of chairs and sofas. Car seats and bouncy seats are not safe sleep environments, and many babies easily slip down in these seats, which can restrict breathing and cause suffocation. Having established a safe sleep space where they can sleep alone, now let's look at how we should put them to sleep. Remember the formula, the ABCs of safe sleep. The safe sleep recommendation is to place them on their back for every sleep, every time, even for naps. Placing a baby on their back will ensure the safest sleep position for the baby and ensure that they are less likely to choke. Never place a baby on their stomach or side for sleeping. There are many parents who are afraid of the back position because they believe that the baby could choke on its spit up. This is simply not true. Babies actually clear fluids more easily when in a back sleep position because the windpipe or trachea lies on the top of the esophagus, which leads to the stomach. Any regurgitation like spit up or reflux, which comes through the stomach, would have to work against gravity to enter the windpipe and cause choking. The real danger occurs when the baby is sleeping on its stomach. Any food or liquid thrown up or refluxed will pool at the opening of the baby's airway, making it easier for them to choke. Now that we've established what it looks like for a baby to sleep alone and on their back, let's take a look at the last step in our formula. C, crib. What does a safe sleep space actually look like? Make sure that the crib, bassinet, or pack-and-play has a tight-fitting mattress that fits snugly into the frame. If you can fit 2 fingers between the mattress and crib slats, you are using an unsafe mattress. Then make sure you cover the mattress with a tight-fitted sheet once you have created a safe sleep space for your baby. Next, you will want to remove all items in the crib that might jeopardize a safe sleep environment for your baby. This includes toys, stuffed animals, blankets, pillows, and bumper pads. These items can be deadly, and it takes only seconds for suffocation to occur when babies get wedged against them. Finally, let's take a look at some other things to consider when placing your baby to sleep. Avoid overheating your baby. Dress your baby in only one more layer of clothing than what you are comfortable wearing. Be careful to keep baby away from all heaters, such as space and kerosene heaters, by at least 4 feet. Also, smoke exposure during pregnancy and after birth is dangerous to your baby's health. And always take caution if you or another caregiver is under the influence of any drugs or alcohol. Your baby must have a separate sleep area. Always remember the ABCs of safe sleep. Alone, in other words, room sharing as opposed to bed sharing. Set up the infant's own safe sleeping area in the same room with you, especially during the early months. On their back, every sleep, every time, even during naps. And in a crib, bassinet, or pack-and-play, a firm, tight-fitting mattress and a tight-fitted bottom sheet, and a surface without blankets, quilts, bumpers, or toys.